Hello, I'm Dr. Kakuli Kumar. I'm a consultant gynecologist practicing in Kolkata. Today I'd like to share with you some very simple but nevertheless very important information and advice about periods starting in young girls. The very first period that starts in a girl is called menarche. It can happen at any age, usually between 11 and 13 years. However, this may vary from girl to girl. In the previous generation, we found that the average age of starting periods was around 12 to 14 years. However, in this generation, it's happening earlier, sometimes even as young as 9 or 10 years of age. It is important to note that there is nothing worrying about starting periods at this age because it is a completely natural phenomenon over which we humans or doctors have no control. The periods can last for any duration, 2 days, sometimes as long as 10 days. And usually in the beginning, the cycles are irregular. What is a regular cycle? It is usually a 28 to 30 day cycle. Now this usually does not happen in a young girl when she starts periods for the first time. The cycle is irregular, meaning it may be longer than 30 days, 40, 45 days, sometimes even 2 months, with a gap of 2 months, and sometimes they may be very frequent, as frequently as 10 or 15 days gap between periods. Now, if the period cycle is prolonged, meaning if it happens later, it is actually not a problem unless it stops for a few months. In fact, we doctors believe that this could be a slight advantage for our young patients because she is going to have fewer periods. However, if the periods are very frequent, meaning 15-20 days, and usually we see along with frequent periods the flow is also very heavy, that can indeed be very uncomfortable and frightening for her. Can pain happen? Yes, of course, pain can happen in any girl or any woman for that matter having a period. It can be mild, medium or severe. Whatever the type of pain, she does need medicines to reduce the pain. So what should you not worry about, and when should you see your gynecologist? What you should not worry about is the age at which it starts. Like I have said, it's a natural thing and we cannot modulate or change that age. You should not worry if the periods are light because that is actually an advantage for her. You must not be concerned if the period is slightly delayed. I think this is very flexible. Anything between 1.5 to 2 months gap is acceptable. When should you seek medical consultation from your gynecologist? If the periods are very frequent, they are very heavy, or both, and if she has any degree of pain. I would like to end by saying that if for the mothers and guardians of young girls, if they haven't as yet started their period but are coming up to that age, then it would be a very good idea to have a talk with her at whatever age you think is appropriate to mentally prepare her so that she is less frightened when it first happens. Another simple measure, especially for mothers, is to keep a little pack of sanitary towels and underwear in her school bag so that if it starts for the first time in school, she is a little more prepared for it. I would also end by saying that do not restrict any of your daughter's activities at this time. Let her study, do tuitions, play games, dance, go out, do whatever she would normally have done. This is all for today. I'll soon be back with more medical advice and tips. Until then, stay happy, stay healthy and look after our young girls. Thank you.